down here on Riverside. Hello, everyone, and good morning again. We appreciate you joining us today on this beautiful Tuesday. We are super excited to share with you some incredible content around acting like owners and saving like owners as it pertains to your healthcare plan. I've got a wonderful panelist group today that I'll make some introductions to here in just a second. But some of the key takeaways from today's conversation, um, first and foremost, this is kind of crazy to hear, but the healthcare system is actually not broken. It's working the exact way that it was designed to, and that's to make a lot of people money in the wrong places. It's not because of how it's actually built, but and not because anyone is careless. It's just the design that is in place. So most of the cost problems are actually structural in nature, which means they can be worked on. And you can do that through some powerful partnerships like we've got today, through the messaging and some of the ideologies that they put into place. Our job is to obviously help employers see clearly and buy smarter when it comes to insurance. So my name is Chad Side. I'm actually one of the key principals here at Gibson. Got a keen focus on self-funding strategies in the marketplace. We are also an employee-owned organization, and I'd like to make some quick introductions on your panelists and presenters today. So first, we have Hannah, who is VP of People and Culture. She also sits on the executive team with TrueScripts. TrueScripts is also an ESOP, and we're lucky enough to have them here in Indianapolis, in our marketplace, or in Central Indiana. Dr. Inman will be talking about some of the core competencies around centers of excellence. He's an anesthesiologist by trade, good friend of mine. He is also now the co-owner of Wellbridge Surgical, which is an independent surgical facility, second of its kind in the country. And so he's going to share some ideas around how we can really start to lower some cost and spend with that model. And then Richard Dunn is one of the subject matter experts when it comes to implementation on forward thinking on creative solutions and ideas around funding strategy, in particular healing together. So we'll talk about how we can really lower some of the cost care spend through that model as well. So these are the three care areas that we'll be talking about. We hope that if you do have some questions, save them for the end. One of the questions that came about preemptively was through Jim Myers. If you're on from Horizon Paper, he actually this will hit the nail on the head. He said, how do we lower cost of benefits with an older pool of employees and some with some major costs? So I think these three key areas we'll be able to focus on just answering how we can achieve and accomplish, again, shifting the change, but also not only for better outcomes and lower costs for your employees, but from the healthcare spend side as well. So with that all being said, I'm going to turn it over to Hannah to kick off the PBM strategy conversation.
Yes. So good afternoon. I'm so excited to be here today to answer just that question. How can you save money on your healthcare plan? And I think that starts with having the right kind of partners. So very excited to share a little bit of information about TrueScripts and in general transparent PBMs. If you don't want to work with TrueScripts, there are others out there. But we're a unique PBM. We do things a little bit different. And we're also an ESOP. So we have, our clients and our team members in mind with everything that we do. So just a little bit of background, on the PBM space here. If you work with a traditional PBM, you're going to face some challenges. They are going to spread price you. I know the hot topic right now is rebates. People think, I have one of the big three PBMs, but I was able to negotiate that they're going to give me all my rebates. Well, you better have an attorney read their messaging very carefully, because they are redefining the definition of a rebate, and they're getting around still being able to, keep some of your rebate dollars in that way. All of the hidden fees that they have. So they own their own pharmacies. They get money from you in multiple different areas and facets. And then also shareholder pressure for margin growth. And this is where, if you work with an ESOP PBM, you're not going to experience that. We're not backed by private equity. We're owned by our own team members. So we are acting on behalf of our clients. And then, of course, our own team is very motivated to do what's right by our clients and members, as we're all owners of our company. So, how can working with a transparent or an ESOP PBM be different than those traditional PBMs that you read about online or you hear about in the news? The first thing is we're invested in our long-term client success. Relationships are everything to us. Relationships with our clients, their members, our own people. And so we want to do what's right for our clients, seek that lowest possible cost, because we want long-term relationships. We have a great focus on, number one, transparent pricing. Transparency gets thrown around a lot, and it's not truly transparent in a lot of ways. But if you work with a ethical, what I will call an ethical PBM, you will get a very short SPD. So ours at TrueScripts is 15 pages long. Most PBM SPDs are around 40 to 50 pages. So you're going to get very, straightforward pricing, and you're going to know everywhere that you're getting charged. We're going to work on sustainable cost management, quality in service. So amazing care is what we hashtag it at TrueScripts. We want to make sure that we're truly taking care of the members and our clients. We're also, go back, Chad. Sorry, we're also caring about member outcomes. So not only about saving our clients money, but are your team members truly getting the care that they need? Are they taking the right medications? Therefore, other things don't happen down the road. And then we have no pressure, like I said earlier, to maximize shareholder profits because we're an ESOP and we own the organization as team members. Now you can go, Chad. Sorry. So carving out your PBM. This is, I truly believe that carving out your PBM can be one of the areas that you can save a lot of cost on your health plan. So you can gain more control over your drug costs. So I know at TrueScripts, we have a lot of partnered pharmacies where we have true relationships and we can seek that lowest possible cost. You can customize your drug formulary. We don't make your plan fit into a box. We're willing to work with you on what drugs you do and do not want covered on your plan. We have enhanced clinical oversight, lots of pharmacists on staff, always looking at your plan, always looking, hey, where could we make changes? What medications are on the plan that shouldn't be, things of that nature. And then flexibility in plan design. Once again, if you're with a larger PBM, they may fit you into a certain plan that doesn't necessarily work for your organization or your drug spend. And you do have more flexibility with a carved out PBM. And then, that improved transparency that we've already talked about with the detailed billing and things of that nature, where you're going to know every single place that you're spending money. So how can you truly manage your pharmacy spend? First of all, pharmacy contract negotiation of pharmacy reimbursement rates. That's where those partnered pharmacies come into play. That's where your PBM has to really be acting on your behalf. One thing we do a little bit different at TrueScripts is we have zero pharmacy ownership. And so we are truly seeking the lowest possible cost. Even with our partnered pharmacies, if they aren't the cheapest, we are willing to use other pharmacies in order to get that true lowest cost. Your formulary options. I know when a lot of times when you're with the larger PBMs, they don't focus on, what's best for you. Do you need a closed formulary or do you need an open formulary? With the closed formulary, you can really focus on those rebates. It's a little more restricted, but you might have better savings. With an open formulary, it is less disruption to your team. And there are things that you can do to still mitigate costs. So what is the best strategy for you? And then one of the most important things I feel like is the lowest net cost option. So at TrueScripts, we look at everything. We look at what's cheaper, paying for this drug now, getting the rebate on the back end, since we pass through 100% of rebates, or is it international? Is it, 340B pricing, something of that nature? So truly seeking the lowest cost because we're not getting paid on, if you get a rebate or not. Rebate optimization. I know that's a huge topic right now. So, what's going to drive the best rebates for your plan? And then there's tons of other programs to consider. What drugs should you exclude? We call those the dumb drugs. We want to get those out of the plan right away, like the Duexis of the world, where, two generic drugs equal a brand drug that you can buy over the counter, those type of things. Utilization management. Are people taking the drugs like they should that are going to prevent, illnesses down the road? Using copay cards, split fills. If you're not familiar with that, that's where, we're really going to manage how people fill their drugs. So maybe if somebody's on a very expensive medication, we start them off on a 15-day or a 30-day fill versus a 90-day fill. So that way there's not waste. If they get on that medication and have a reaction and we've approved a 90-day fill, then that medication is going to be wasted, therefore wasting cost in your plan. DAW penalties. This is dispense as written. It's where, if a doctor writes a brand name drug and the member refuses to switch to the generic when a generic comes to market, then we say, hey, that's fine, but you're going to pay the difference between the generic copay and what the true price of the brand name drug is. And this prevents people from saying, hey, I'm not going to switch to the generic, unless they have an allergy or something of that nature, then the penalty can be waived. But it's your PBM protecting your plan from paying for brand drugs when there's generics available. International fulfillment. I know at TrueScripts we have integrated international programs where they actually run through the plan. We make sure it's the lowest net cost option. And then mail order. We have an open mail order at TrueScripts since we don't own any mail order pharmacies or any pharmacies at all. But making sure that you have people utilizing mail order to get the savings. So, overall, there's a lot of different ways that you can manage your pharmacy spend. And, I'd be more than happy for Chad to share, TrueScripts information, my information, if you want to talk more about that. But please know there are ways to do it, even if you have an aging population.
Thank you, Hannah, for that. Yeah, one of the things I heard actually earlier last week, somebody had said, I just can't stand health insurance. I think it's a scam. It's almost a game. And to be honest, they're not wrong. You'll see a lot of the hospital systems or the big network carriers, the Anthems, the UMRs of the world. They own their own pharmacy. They have everything in house. And unless you're of a certain size, the one area that they don't allow you to carve out or become strategic in nature, even though they say they're doing it in the best interest of the members, is pharmacy. And the key reason behind that is because of cost. There is so much money in pharmacy and so much money to be made for these network carriers that they want to keep it for themselves. So if we can think a little bit more of outside the box, where can we start to pull some of those levers and become strategic by unbundling the PBM, using someone like a TrueScripts who is independent? I think that's where you can start really to squeeze some of the juice out of the lemon, so to speak. So appreciate you sharing that.
Absolutely.
And one of the key things too, and again, I mentioned this at the beginning, no one strategy is really going to shift a ton of change. You might be able to get a little bit out of a PBM. You'll get a little bit out of a different funding strategy. You'll get a little bit different savings maybe out of such as a WellBridge. If you put these into combination with one another with an excellent TPA, obviously thinking about stop loss, so on and so forth, that's where you start to see some strategic change and challenging the status quo. So with that being said, we're so lucky to have Dr. Inman to talk about WellBridge Surgical and his centers of excellence.
Yeah. Hey, everybody. Appreciate the opportunity, Chad. And thank you, Hannah. I feel like a lot of people say that surgery costs and surgery, payment model is confusing, but every time I hear somebody talk about pharmacy, I realize that that's probably a little bit more confusing than surgery. So every time I learn a little bit, so I appreciate that.
Absolutely.
So like Chad said earlier, I am an anesthesiologist. So, about half the time I'm in the operating room. I got out of residency in 2010, and in about 2017, I'd had the opportunity for 7 years, really for 10 years, counting residency, to be working with a lot of the best surgeons in the Indianapolis area and some of the worst surgeons in the Indianapolis area. And so, I kind of found myself wanting to dig deeper into the reasons why patients were ending up in the OR with a great surgeon versus a mediocre or a poor surgeon, because those do exist whether we want to believe it or not. And so in the digging deeper, that kind of gets to the current challenges here on this slide. Everybody knows that the premiums are going up. The amount of overall healthcare costs are going up, and that's not in small part due, obviously, to pharmacy that Hannah talked about and Chad talked about. Outpatient surgeries, I think, are, at least in our estimation, around 10% of the cost of the whole health plan. Everybody's realized that everything really is growing, and so as far as cost. And so the crazy thing about the cost of surgeries is that you get so many bills. So you get, like, most people probably on this call have had the experience of having a surgery and getting the bills, maybe 6 months later, 9 months later. Sometimes it's earlier than that, but it's several bills. You got, say you're going to get your gallbladder out, which was my first surgery in 2018. You have the bill from the surgeon, the bill from the anesthesiologist, the bill from the pathologist, the bill from the facility, and it's just it's at least 4 bills that you're going to get, and that's for a lot of different procedures, and sometimes there's multiple bills from the surgeon and from the facility. That leads to pricing is, I would say, it says here difficult to compare. I would say impossible to compare, and that creates that, like what Chad said right when we started off. It's been kind of a planned. It's been very purposeful to make everything so opaque, and the lack of transparency contributes to the ability for each of those people who are sending those surprise bills to be able to maximize the amount that they are reimbursed. And so what we're trying to do is to solve for that. The employees facing growing deductibles and out-of-pocket costs. I've seen this since founding Wellbridge Surgical. I've seen this, that sometimes people can't afford $400 deductible, and they will literally put off getting a gallbladder taken out when they need to get that gallbladder taken out to avoid the complications of pancreatitis or cholecystitis, to different things that can cause more of hospital stay, more of a big problem that everybody wants to avoid, including the employer. But certainly the members, which is I have a passion for, to avoid that. With these growing deductibles, that's a huge challenge that I didn't even realize how much of a challenge it was until I got into this. And so, looking at all these challenges, back in 2017, realized that, hey, I know a lot of the surgeons that work around here, and I know that if we're not part of a health system, that we could offer, higher quality healthcare by picking the surgeons, by picking the staff at a lower cost, because we would not be beholden to the system. We wouldn't have all that overhead, and we would be able to control our costs, making it more of a free market. So that our solution, and what we have here on the right, is basically the Wellbridge Surgical would be the price that we make, the price that we post on our website, the price that we charge Anthem and United and self-pay folks who are paying cash. Same price for everybody. So it's pretty simple. You can look on there. I won't go into the details, but we just add everything together. Basically, our cost plus a small margin per OR hour, and that turns out to be, we didn't know it was going to be this when we started, but it turns out to be about 50% less than the average cost in the market. And so, thanks, Chad, for changing on this. The pricing is a couple years old on this, but it's the only time that we had actually United Healthcare. They actually went in and they found it's not very easy. When we said it's difficult to compare, it's even difficult to compare for the United Healthcares of the world, the Anthems of the world, to go back and add all the different pieces together to get basically what we'd call a retroactive bundle. We have a bundle that we post online. A retroactive bundle will be looking at your claims for 2025 and saying, okay, you had 7 gallbladders with your members removals. How much did that cost per gallbladder? It's not super easy, but United did it once. And so the prices have gone up on each side a little bit, but it's still about, you can see it's about 50% less is our price. And the crazy thing is you can have somebody doing a carpal tunnel, a surgeon doing a carpal tunnel at 86th Street Ascension or IU Health, and that same doctor can be doing it at our place with staff, with anesthesiologists they've worked with in the past, with staff they've worked with in the past, meaning nurses and CSTs. And it can cost half the amount. It's one of those things that we constantly have to be explaining why it's not too good to be true, because it's really not. But these are factual numbers here, and it can be done. To do this, what my passion is you have to turn a passive healthcare consumer, which all of us are and were. If that's the point of the system, to make you a passive healthcare consumer. So where your primary care doctor that somewhat sends you to a surgeon that you probably don't know, and they take you to a place that you for sure don't know how much it's going to cost there, or really what the quality is of the staff there. And so what we want to do is decrease the amount of variables in this, to say that we have handpicked the surgeons, and we will show you how much it's going to cost. And so overall, that can lower your healthcare spend by 50%. But again, to create an active healthcare consumer, you have to make it really a win-win situation. A lot of if you tell a member, hey, you're going to save a lot of money for the company to come to basically to go on this side of the street versus the other side of the street, they're not really going to pay attention if there's no they don't have any skin in the game. So what we've been working with employers to do, and we didn't do this on our own, like Chad said, we're the second one in the country, not the first, but learning from the Surgery Center of Oklahoma, who we modeled ourselves after, they said that really to move the needle with the employer and the cost and the savings that gets passed on to the employer is to share some of that savings with the member, the patient, and the ability to waive deductibles and coinsurance is really what we call zero tiering, meaning that you got tier 2, tier 1. Well, zero tier would be a zero out-of-pocket cost to the patient to pass on some of that savings that the employer is enjoying to the employee, so that you capture that savings. Because in the end, the patient, the employee is going to have, I believe at least, should still have that choice. Up until it becomes entirely unsustainable and they need to have that choice made for them. Creating an active healthcare consumership is what I, from that point in 2017 when I was wondering how these patients got here. Well, it's because they didn't know. It's because they're passive healthcare consumers, and there is no transparent free market in terms of outpatient surgery. And so what we do is we offer that. And so we were working with 80 to 100 different employers around Indiana, and Chad and Gibson have been very helpful proponents of what we're doing and believers in us. And we've saved saved employers hundreds of thousands of dollars. So say if you do say it's 10% of the healthcare spend that we can save you, then it's if you're $5 million is your total healthcare spend, we can save you $500,000. And that is with 100% adoption, but which would not happen initially. But there's a lot of dollars there, and like Chad said, it's part of the strategy of working in every different area of healthcare to say, we're gonna take this strategy here, this strategy here, this strategy here. We know that we're really the best strategy for outpatient surgery in Indiana. Or what I like to tell people is they say, what's your quality? What's your outcomes? Well, we are a free market, and I'll end with this. We are a free market. So basically, because we're free market, we depend on referrals and how well our outcomes turn out and our patient satisfaction. That's how we keep patients. That's how we stay in business. And that's different than the hospitals. So I'll leave it at that, and then be happy to answer any questions anybody has at the end. Thank you.
Thank you, Dr. Inman. Yeah, you made a good point. Decreasing the amount of variables by implementing an incentivized plan option, right? whether it's even a low cost share or a zero tier. Whether you're in Oregon or Florida or Texas and you're not fortunate enough to have a well bridge in your backyard, the direct contracting piece of this or component can be done anywhere in the country through your advisor, your strategic advisor. And the key on this to really start to drive the change is the care navigation component of incentivizing your people, right? Highest quality, lowest cost. Data is so powerful. It's out there. We can obtain that, create a direct contract with the facility of choice that hits on all those components will really start to drive down the cost and improve the outcomes. A quick last personalized story just to tell you, my wife, I've been in this business for 7+ years now. She still doesn't fully comprehend what it is that I do, I believe, but she is of the age where she needed a colonoscopy. I had done mine at Wellbridge. We have a program in place here at Gibson. It was actually a $500 flat fee. So it was total out-of-pocket cost for any surgical procedure done at Wellbridge was $500. As you can see, the colonoscopy was like $19.90 or whatever. It was my $500. I said, hey, my wife, please just go to Wellbridge. She wanted to use Dr. Singh, who was part of Franciscan. He actually had the ability to go to Wellbridge, but she had heard high things about him. And so she inquired from a billing perspective. You saw that no billing surprises that the hospital systems are supposed to implement. She reached out. They quoted $2,100. She saw that Wellbridge was $19.90. Now we only had a $500 out-of-pocket expense, but she was like, that's not even that big of a savings at Wellbridge. That was her mindset. What she didn't realize on her bill estimate that they had sent her via email at the very bottom in small lettering said, for the facility fee, call this number. So there was a separate charge for the facility fee as there was for the actual procedure on the colonoscopy. I proceeded to call the facility and said, hey, I'm just curious, what would be the billing charge? And they said, well, what's your insurance? I said, UMR. They said $6,800. In addition to the $2,100 they were going to charge. So it was an $8,000 colonoscopy versus the $500 that we had through our program. So there are still ways that they can hide those charges and fees, whether they call it no surprise billing or not. They're just backloaded in on the facility charge. So the second you step foot into that facility, you're getting hit with that enormous bill. So those are just some of the nuances and things to keep in mind when you're creating some opportunity for your employee owners. Thank you, Dr.
Hey, Chad, real quick, I'll give a shout out to Wellbridge. We are a client of Wellbridge at TrueScripts, and we had 2 people utilize Wellbridge for surgeries last year. We have a young workforce, so not a lot of surgeries, but we saved $56,000 from our plan, according to our broker, just letting us know that, hey, if you would have done this at a traditional hospital, it would have cost the plan $56,000 more. And the facility's beautiful, and our people gave raving reviews about utilizing Wellbridge. But to both of your points, we do $0 copay if you're on a PPO to go to Wellbridge, and then we do a reduced copay if you're on a high deductible plan. But our team loves Wellbridge, and we will continue to partner with them. And we even have remote team members across the United States, but we will pay for travel to Wellbridge just because of the amount of cost savings that we get through their program. So shout out to Wellbridge from a happy client.
Thank you very much. Appreciate it. So now, Richard Dunn, we're going to go ahead and talk about this new creative, well, not so new. I know we here at Gibson have been implementing this solution for about 4 to 5 years now. Got a handful of clients who have accessed this, but this kind of goes to Jim Myers' question earlier on about how are you really starting to control some of those major high cost claimants? Like, what are you doing to facilitate change? And I think there are some solutions such as Healing Together that Richard will talk to you briefly about today. And again, be more than happy to answer any questions after the fact. Richard?
I also own a TPA. Shopping the stop loss, helping the brokers stop loss, whatever. You have these high dollar claimants for concerns from the stop loss carriers. And some of them can turn into lasers, some of them conditional lasers, some of them are that little conversation we have with the underwriter of, hey, we like this person, but we have. So, as a TPA, we started to take those people off the plan, put them on the marketplace or an individual policy, and we pay 100% of their premium, 100% of their deductible copays out of pocket, and life is good. So it works. In our little tagline there is all for one and one for all. So if you look at the employer and the employees, all the employees in the all for one, all of the employees are happy that that particular person is off the plan because that person driving up 50% of the cost, 30% of the cost of that renewal. And so they're glad that one person's off. The one person that is off, the high dollar claimant, is happy because they're getting 100% of their premium deductible and out of pocket pay. The employer is happy because our fee for this is less than the spec level that they would have paid, or even less than the laser that they would be responsible for. And of course, the stop loss carrier is happy about it. So, vicious cycle, all the stakeholders are happy campers when we're able to come in, educate the member to move off the plan and go to an individual plan. So we were doing that for our own client as a TPA. And one of the stop loss carriers goes, hey, we had a laser on this person. We don't see that person within the census. And I said, no, we moved them on. That happened a couple of times, and the stop loss carrier goes, oh, well, can I introduce you to other brokers that we deal with? And from there, Healing Together was born, it exploded. It's a full company that is doing wonderful work, caring work, compassionate work for members that are stressed from their financial expenses on their medical plan. And with that stress, when they bring it to work, they're not productive employees. So the indirect savings to this is when we're paying 100% of their premium, their deductible, they're out of pocket, they become more productive employees for that employee. And they're happy, they're motivated, and so it just works for them. So the logistics of it is it's a qualifying event as far as they have to qualify to come on. We send them it's offered to everybody. So at open enrollment, we offer this to everybody, but you do have to qualify. We said we do it through a HIPAA agreement, we send them an application, we have a medical intake, we have a pharmacy intake, so we're trying to match that pharmacy with the individual marketplace formulary. We're matching their providers with the in-network providers to the best of our ability, and we offer them the plan. They get to choose which plan they want. And once that's done, we issue them a debit card that pays for their premium deductible out of pocket. So we were able to put that other slide in, but yeah, perfect. We get this all the time. So just wanted to share, my daughter underwent surgery last week, and the surgeons were able to detect and remove an aggressive cancer in the early stage. Without Healing Together, we would have delayed the surgery due to the financial implications. And the cancer may have run rampant, and the outcome could have been unthinkable. On behalf of my family, thank you. My daughter is doing well and may face more procedures, but the doctors are sure this was detected and removed from the nick of time. Words cannot express the amount of gratitude. Have a blessed day. you are providing. We get this once, twice a month for the members that we have. It's heartwarming. We're
Yep.
able to help you out. If you have a high dollar claimant that's affecting healthcare renewal, please.
Thank you, Richard. Yeah, this is an incredibly impactful program, and this doesn't work on its own. You need to be intertwined with a very smart TPA, but also have a stop loss carrier who is willing to bend over backwards and work in ways that others do not. What I mean by that is most of you are probably very familiar with the set it and forget it model. Hopefully that's not the position you're in today with your current broker or advisor, but oftentimes they'll put you into a strategy. You'll have those conversations maybe in January or February. How did the renewal go? You may not hear from them again until August, September. For a particular situation on a client of mine, I actually received a phone call the third week in January direct from the TPA who had said, "Hey, Chad, I want to give you a heads up. There's a member with this particular client who has hit some claims early on, and this is going to be very expensive. This is going to take a pathway that is going to be very costly. We probably need to think about another solution." I called the stop loss carrier partner that we were with, got both of them on the call together and said, "Hey, I'm going to recommend that we propose the Healing Together Fund charity through this program for this client to see if we can't hit the nail on the head before this becomes a runaway train." Lo and behold, the family was accepting of it. We got them onboarded for a April 1st, which still reduced the massive claims, which are still ongoing from a stop loss perspective. Even though we hit the spec, what we're going to achieve on the back end is the stop loss carrier now is going to be very mindful at renewal because we didn't blow this through, $1 million of the reinsurance claims. So they're going to obviously achieve a win-win both through obviously the member and making sure that they get healed and better, but also from an employer spend perspective. So without that, if the TPA doesn't reach out to me and we're not obviously taking a look at the claims on a monthly basis and making sure that we're proactive in nature, it probably would be one of those things where you'd come September, October, you'd see the high cost claimant, stop loss would say, "We're going to give you the 30% renewal max cap rate, yada, yada." It's the same status quo that happens year in and year out. So just being proactive and working with wonderful partners like Richard and his team can definitely help to shift some of that change. So appreciate you sharing that. All right, that leaves us a couple of minutes left over for any questions. I don't know if Jessica, possibly, if you've seen anything in the chat or if anybody has anything that they'd like to ask voluntarily, we're more than happy to answer those at this time. Otherwise, you're also more than welcome to either contact me via cell or through email. More than happy to get those questions over to the subject matter experts in their own right. And answer those as they come in as well. Are there any questions that we can answer at this time? Yes,
Yes.
absolutely. Any others? Excellent. Well, we appreciate everybody's time. Again, thank you. We hope you have a wonderful week. We'll give you a couple minutes back in your day and look forward to connecting with you at some point, hopefully, whether it's at an NCO or NESOC conference as well. So don't be a stranger. Thank you very much, Eric, Richard, and Hannah. Appreciate your guys' time.
Thank you, guys.
Absolutely. Thank
Thanks,
you.
Chad. Thanks, everybody.
Take care.